This is demand theory and its application for MHA618, Health Economics. I'm Naomi Johnson-Effinger. This presentation is a role play of an associate director, played by myself, speaking to a CEO. Good afternoon. Recently, we discovered that we had several projects in line that would benefit the community. This very brief presentation is to demonstrate the need or demand for one of the proposals on our list and its application. I'd like to share some of the reasons we should consider the demand for alternative care by opening an urgent care clinic about 20 miles from our main campus. In this next slide, you'll be looking at the microeconomic model for the implementation of that proposed project. We know that many of our clients live in the city, but we now know that extending our clinic to Orville, a community about 20 miles west of Selma, will serve the community that frequents the emergency room and primary care clinic for urgent care over 70% of the time. Quality management, who's passing out the handouts, has shown us those figures. We've concluded that the placement of an urgent care clinic in that area will reduce the use of our emergency room for non-emergent issues by 75 to 80%. If we're to meet the demands of care required by the community, we are obligated to implement an urgent care unit or clinic in that area, from which the majority of our clients utilizing the emergency room after hours and on weekends for urgent care needs reside. We'll be the first to establish such a clinic in that area, giving us a competitive edge against the competition. Moving on to our next slide, let's talk a little bit about the role that public policy plays in terms of the provision of healthcare services. We want to make no mistake about this placement. This will give us a competitive edge in the community because none of the other 7 large hospitals have urgent care clinics in the surrounding communities, especially not in the Orville area where we have most of our Medicaid and our Medicare clients residing. We know that the majority of our ED visits on the weekends and after hours are for colds, ear infections, and other non-emergent care. This clinic is going to offer an alternative to the residents of the Orville area and the surrounding counties to driving 20 miles and then having to sit in an emergency room for long periods. The average wait for an urgent care clinic is approximately 30 minutes. We are also required to offer alternatives to emergent care under the Affordable Care Act. This project will provide not only that compliance to the Affordable Care Act, but it will provide compliance for HIPAA as well. All urgent care clinics, in addition to that, those in operations, must meet the standards of compliance for accreditation under the auspices of UCCA, Urgent Care Centers of America. In our next slide, we're going to address financial data and proposal justification. The relevance of the current financial data is that in terms of the projected outcome of the project for placement of the urgent care clinic in that 20-mile radius of the main campus, we should understand that the use of an urgent care clinic is less costly than the use of an emergency room. This will increase the demand for use, and in turn, turnaround time for receiving care will also enhance the desire to use that urgent care clinic instead of coming 20 miles to the emergency room. In addition, urgent care clinics take most payer sources. They take Medicare, they take Medicaid, they take self-pays, they take other insurances, most all insurances. The fees paid are usually based on the services that the consumer receives. We anticipate 2,000 visits per month at approximately $130 per visit. This translates into $260,000 per month. Fixed costs are going to cost us $100,000. The variable cost is set at 10. This translates into $130,000 of earnings on a monthly basis. As you can see, it's equitable for us to invest in this project. With every project, there are challenges. The economic challenge here is what we're going to discuss next. We call disadvantages challenges. One challenge is the higher cost of using a primary care clinic as compared to using primary care clinics and primary care physicians. Another is finding physicians who've been trained for urgent care clinic services. Most physicians just aren't trained for practicing in urgent care. Another issue could be staffing in urgent care. That can become an issue in that most staff, like most physicians, are not trained for urgent care. It's also harder to retain staff that work in urgent care clinics. One main reason is that there is a no appointment necessary rule. This can cause a problem when the number of patients stack up, become large, and overload the staff. The staff will certainly experience a challenge. Moving on to our next slide. What are the benefits? What are the rewards? Paying customers in urgent cares usually receive discounts. There are no appointments needed. It's cheaper than an emergency room visit. They're open 24 hours a day, 7 days a week. The urgent care accepts all types of insurance coverage and self-pays as well. Diagnostics are always available 24/7, just as are labs. They provide immunizations. They provide booster shots. Medications can be obtained either on site or by prescription at the corner pharmacy. They offer physicals and screenings for school and for employment. All of this is non-life-threatening care. The urgent care is designed to manage non-life-threatening illnesses. This concludes our presentation today. We believe that we've demonstrated the need for opening the urgent care in Orville. We believe we have also demonstrated the need and the benefit that it will provide ABC Hospital, the community, and you.